Hi Rupali, come. You've come alone or you have some people with you? Alone? Okay, no problems. And yes.
So I want to get done this.
Okay.
And
You definitely need all of this, yeah.
what else? Like this is required or not? Like I'm not sure.
Okay, I'll let you know. So have you had any procedures till now? None, no? Okay. Okay, so see, don't do anything here, but you could do something here. So that your whole jaw, see your jaw is really short. So we need to bring it more vertically also high and horizontally also forward. So that we can do with genioplasty, angle osteoplasty, the entire jawline thing we can do. It will have two more improvements for you. Your lower lip is now in this shape and everted. That will correct automatically. Without touching the lip, automatically it will get corrected. Nose, yes. So we can give you a nice narrow nose, pointy tip. I can give you a nice pointy tip.
I want it narrow.
Yeah, everything will get. No possible.
Okay, and this I don't want. This one you can see like
Yeah,
I don't want.
that will be corrected. I'll correct that.
That's it. And when you increase this, so like this one
He'll get
also,
better. The eyes look better. This patient
yes.
who came in before was only asking
I
that.
saw that.
Eyes will look more youthful.
Yes.
Definitely. But we'll need rib.
Okay. That.
Your case 100% I'll need.
Okay.
See, there's no support, flat. I need to really build up. So we'll need rib for sure.
Okay.
You've taken appointment for today, Rupali, or tomorrow, or what is the thing?
You given me first, like I don't know with whom I was speaking.
I'm also aware, but there's an executive also for that. But I want to know when the appointment was given for you.
1st of April only. Like I don't know for consultation or for surgery.
But how were you prepared? For consultation or for surgery?
I just came. I'm not sure. Like if you want to do, you can do today.
No. No, Baba, we need to do planning, scan, dekhna. It's not like just like that. Why I'm asking is because you've come from a long way, na. So if we are planning tomorrow, you can take rest today. We can. That's why I'm asking.
Yes.
And plus, you're on some medications.
Yeah.
So we have to just make sure our anesthesiologists and physicians will see. And you've slept well or you're not sleeping
No,
well?
I'm not sleeping well.
How many days?
Like I think a week.
Why?
I do night shift actually.
Oh,
Yeah,
no
that
wonder.
is also the problem.
So now when have you stopped doing the night shift?
I'm planning to change.
Not like that. Like, did you do it last night?
No. So I couldn't sleep last night actually. Like I.
Because
slept
you're
very
used
late.
to this kind of
Yeah,
working
yeah.
schedule.
Mhm.
All right. So you reached here today.
No, last night.
Last night itself you reached, but you couldn't sleep well last night.
Yeah.
So you're right now tired, right?
Yeah, little.
So what we'll do now, because you look tired and I don't want to do surgery when the
Also,
patient's really
feeling
tired.
weak,
I know, I
actually.
see it on your face.
Hmm.
So what we'll do, fatafat, we'll take your scan. I think your scan is already done.
Yeah, it's done.
Scan is done. Blood test also will run. You talk to my executive for tomorrow or Monday, whenever we can give you earliest, if possible.
So I need to return on 8th.
So it has to be tomorrow in that case, as early as possible, right? 8th is like just 1 week ago, 1 week away.
Saturday.
Yeah. Can you postpone that by like 2-3 days if need be? See, because see, these are all not minor procedures, right?
So nothing will happen no after that.
Not-
Like
Nothing will happen to you, as in there will be swelling, there could be some bleeding, but you are
in
staying here.
future or like
Nothing
if
in
I'm
future. What will
bleeding or
happen? No, nothing will happen.
Like
Future, you look much more beautiful and much
the
more
gram
confident.
or something like hard thing if I chew.
Nothing will happen. Your bone strength will be the same as what it's right now after a few months.
Okay.
So no problems. But see, the initial healing is required.
Yes.
So if you want to go in 7 days, little tight. Because usually, if you remember, every place I say 7 days minimum, 10 days like that, The farther you come, the longer you have to stay here. If you have to go to nearby, I can send you in 3 days. Because I'll call you again for a second review.
Yeah.
But if you're coming from such a far off place, how can I send you and call you again? So that is something you have to tell me. Because timing You have to tell us.
So if you do on Monday, so like because I need to get done my teeth also.
Teeth,
So
what
if,
is the
if
problem?
Today it can be.
What is the problem with the teeth?
I like 4 teeth are not in good condition. So
Oh, the
want
wisdom tooth. Open. Open. Oh yeah.
I want to get it done.
That they can do easily. That is not a problem.
Today?
That they can do it today also. If you are up to it, not tired and not sleepy like this,
So
you can.
after that I can take rest for 2 days and then we can
Sure.
do on Monday.
Yeah. Fine. You definitely need at least 1 day's rest. That's what I feel. Nice sleep is what you need, and relax for a day. And see, these are surgeries that are not emergency surgeries. Matlab
I
just.
cannot come further.
I know. No, but that I understand. But you can request for a week's leave. That's all.
Week sleep like
1 week leave.
so I have already taken, but my flight is on 8. That is
No, but you can work from home here, right? If suppose you have to stay,
here.
you will be able to work after a few
I
days.
have taken leave for 3 weeks. So I'll
Oh.
go home, then I'll
Then take rest there.
Yeah.
Okay. So my concern is if you're doing on Monday, Monday is already the 3rd.
Third, okay. So I'll get only 5 days.
Yeah.
So is that okay?
No, not okay. That's why. That's too short a time, Baba.
So how much time?
I said no, 7 to 10 days.
7 to 10.
Yeah, safer. Because you're coming from very far.
Yes.
I can't let you go there and
I'm trying to postpone my flight if possible. And then
you
I
have
can
to.
stay.
You have to. Otherwise, we can't do surgery. 5 days is risky, Baba. No. See, look. जॉ करना है हड्डी में काम है नाक करना है हड्डी में काम है रिब निकालना है हड्डी हीलिंग ना बोन हीलिंग टेक्स 4 weeks minimum. So if you are nearby for a follow up I can call you. If you're far away how will I do that? And you're going to some far away city, then I don't know who will follow you up. All headaches. They'll not know what we are doing. These are all major surgeries.
After that, doctor, if I want to get done in my teeth, like
That all you can do it locally.
like they will scared no like what inside.
Teeth, our doctors will finish you before that only. Teeth, you don't worry. All your dental problems, they will finish it off. That is easy. That is not a concern. That you can finish in 1 day.
Okay.
The other things only we can't finish that quickly.
Okay. So can I know like how I'll get my things after the procedure?
Come here. I'll try and show you how it might look. So bring your jaw forward. नहीं, अच्छी तरह से. Front. This teeth forward. Forward.
I'm not getting.
Like this. More. Now close your lips. Close your lips. So slightly better than this it will be. Only the chin. So you will get an angle here. Chin will be pointy. Okay? Put it back. That is one. When you look like this, see it will go like this. This will come in. Your chin will come like this.
So like it will be straight or it like.
From here it will be straight.
Will it look good on me? Like
Yeah.
I'm not sure.
It will look very nice.
I wanted like round shape is okay for me.
Round will be there here, obviously. It will come like this, not round, and it will come like this. This angle will be
So
there.
you will give some like
No, I won't do anything there. I'm just trying to tell you the angle will be there.
straight angle.
Slightly straighter angle.
Not sure it will look good. Or
You don't want the angle to be touched, we can let it remain. You want it round, okay, I let it remain round. That doesn't matter actually. But it looks nicer if you have a definition there. See, jawline
I
definition.
want it like get done something, but I'm not sure like this much will look good or not on me. Like because I like round shape face.
Then don't do there if you don't want.
Hmm.
If you don't, then don't do it. If you like that, they don't do. It's all up to you.
Okay.
Then let that remain. We'll only do here.
Okay.
Just don't touch that only. That remains the way it is.
Okay.
Done. See, everything is up to what you like and what you want, because these are all cosmetic surgeries.
Yes.
There is no real need to do that. What I like is not important. What you like is more important. I can tell you that it looks good generally, but you like the way it is, perfect. Don't do it. So we'll not do that. We'll only do this chin part. That's easy. This will come down. This will go inside. You'll have a much more better
And
chin.
this is shorter, no?
Yes, a little bit. Not like a lot, a little bit. It will shorten.
I don't like my like this pose like pose.
It will change. It will change. Why? Not only because of this, also because of this.
Okay.
Because we lift it. See, everything is related. Can you see when I lift it, what's happening?
And this grooming will also go.
It will reduce. Not go, it will reduce. You're not having a great amount of grooving, but it will reduce. And look here, there is some loose in here.
Yes.
All that will go away. Your eyes will become like this. That thing will get more clearer. Lot of loose skin you're having there. Here also loose skin. So once you put the rib and lift it up, your nose will get bigger. Your medial canthus, this area will get tighter. This much area will get all tight everywhere. This will get less. This lip will go a little bit short. This will go inside. This will come outside. And this part we're not touching.
Okay, and this side, like I don't like this one also, like the round shape side.
That's nice. What's the problem with that?
Like I want it like a little sharp, or it's like if it is going inside, so it should look like something like shape in shape. It's like फैला हुआ type.
बहुत broad smile है.
हाँ.
But देखो ज़्यादा नहीं करना चाहिए वहाँ पे and all. Already we are talking too many things, right? Now see, यहाँ पे करेंगे, यहाँ पे करेंगे, यहाँ पे करेंगे. Leave it. अगर उसके बाद अब आपको फिर भी want some improvement 6 months, 1 year, 2 years के बाद सोच लो.
Okay.
ठीक है? Then this also we won't do because you didn't like. This also will not do. Just leave it. Only this part, this part, this part, this part will do. No work here. That itself automatically will change a little bit because the muscles are all connected to each other. When we move the bones, the muscles are attached to it. So it brings a little bit of a change. So let's not overdo that part. Okay. So I'll write these things and then you can talk to my executive and then he'll let you know the details. Uske baad you can plan like you said on Monday or no.
Today I can get my teeth job done.
That is easy. If you're fine, if you want to take rest and get it done tomorrow also, it's fine.
No, today is fine because I need 2 days actually rest. Then
ठीक है.
Monday I can.
Sure.